Welcome back, guys. So far we have talked about the nitty gritty about the birth process, as well as those other things you gotta have down before this baby descends into your lives forever. I've also gone through the common pitfalls, the rookie mistakes that first-time parents so frequently make, so that you'll be more prepared ahead of the game. And I want to end this series with a list of proactive steps of things you can do to influence your baby's birth. And we've talked about how you can't control it, but there are things you can do to maximize the chances that your birth unfolds with connection and with heart. The first one is to carefully choose your care provider. Get really solid on who that person is going to be. In fact, it's one of the most important factors in your satisfaction with your birth experience. And the choice of who you hire to co-manage your labor can make or break your hopes and plans for your birth. Now, there are several options available. There are different types of medical providers. The most common one is an obstetrician, also called an OB/GYN. And then there's a certified nurse midwife, a certified professional midwife, and then rarely a family practice doctor. An obstetrician is a specialized doctor who can manage any sort of labor from low risk to high risk, and some even specialize in rare cases, really high risk cases. Generally, their training in a medical school emphasizes a managerial style that sees birth as inherently dangerous and will be more hands-on in making decisions during your labor to minimize any of these risks. Now, there are exceptions, of course, and some OBs are more tolerant of unusual labor patterns. If you are also of this mindset, then this could be a good choice for you. Of course, if you are high risk, then this is the only choice for you. A certified nurse midwife is an advanced practice nurse who can support and manage low-risk cases in a hospital setting, although some work in other settings. Their patients may still have interventions, including options for pain medication, and they have backup obstetricians available in case a birth needs more intervention, like a cesarean, forceps, or if it suddenly becomes high risk. Now, generally, their training emphasizes healthy and normal, the health and normalcy of labor, and will be more hands-off and patient, with a longer labor. There are exceptions, of course, based on personality and place of birth. Now, if you would prefer a longer labor over intervention, or if you're hoping to avoid pain medication, then this could be a good choice for you because their training matches that. While certified nurse midwives and OBs can have practices that operate out of a low-risk patient's home or out of a birth center, their training is hospital-based. Certified professional midwives, they also have a few different terms. Sometimes they're called direct entry midwives or lay midwives. They're the only birth provider who is exclusively trained in at-home births or birth center births. They're exclusively available for low-risk pregnancies and labors and will require a patient to transfer to a hospital if there are complications or if something comes up during labor. In the U.S., this certification varies from state to state. In fact, some states do not even recognize the certification, and those midwives they're working underground. Now, because there is a large disparity in training quality of CPMs or DMs, this one requires more research on the part of the patient to ensure that you're hiring a quality provider. Now, of course, I said there's a family practice doctor. These really are rare nowadays as far as attending births because malpractice insurance is so high for them that you don't see this happening too much. So there's two major factors at play and to think about when you're choosing what provider you want to work with. First is a match in philosophy, a match in approach to what labor means, what birth and pregnancy, all that means. Also, their bedside manner and the respect they give you. Now, if you agree that the birth process is unpredictable and risky, then a provider who manages labor from that approach will be a good fit. And this usually means in a hospital with proactive management and monitoring. Now, if you're on the end of the spectrum that has faith in the untouched birth process, then a provider who manages labor from that approach will be a good fit. You might also consider if you want someone in a big practice of 6 or 7 doctors or midwives, or just 1 or 2, which are harder to find, but they are out there. Do you want individualized or global care, looking at you and your specific case and really making decisions based on the nuances of your situation, or someone who just everyone gets this standard of care, everyone gets this intervention, that intervention? So if you are mismatched with your provider in this basic assumption, it can cause disagreements and disappointment in the labor experience. The other major factor is how your provider treats you. Regardless of approach and management style, it is absolutely essential that you are spoken to respectfully, given clear descriptions and informed consent about any proposed procedures, given agency in decision making, and compassion if unexpected events occur. Now, I'm not going to lie, this is a challenge to find. Many medical providers are under a lot of pressure to just produce health and safety, not having the luxury or sometimes even the talent for therapeutic conversations. It is worth doing the work to find these providers. I've seen many women find their power navigating unexpected events in their labors because they were treated with respect, given information, and shown compassion through the whole thing. If you want to get further into the nitty-gritty of this topic, I've created a workbook to help kind of expand your understanding of the different providers, the different philosophies, and then red flags to watch for. It also has a bunch of questions in there so you can kind of figure out, where are you coming from? That link is below. The next proactive step you can take to get ready for real is to tour your place of birth twice. Most women in America and in the world give birth in a hospital. This is a place that you can go if you're low risk or high risk. Some go to a freestanding birth center, and then a small percentage give birth at home. This giving birth at home or in a birth center are for low-risk women only, and they would transfer to the hospital for pain medication or any intervention. Now, wherever you are giving birth, I highly recommend that you tour it. Go there a few times. Just get really comfortable with that place so that the smells are familiar, so that you can have a chance to ask any questions you have, see what kind of stuff they have available to you to use, what kind of tools, what kind of setup in the room, what are the steps when you first get there, where do you park, all of that kind of stuff. And if you are particularly nervous about hospitals or this particular hospital, you can go, as much as you can fit it into your schedule, as much as they'll let you tour it, just so that you can minimize some of that anxiety you might have. The third thing to get ready, and I'm going to say everybody do this as much as you're able to figure this out for yourself, is hire a doula. Now, you've likely heard this term already, what a doula is. She's just a badass mother helper. All right. Technically, she is a professional labor companion who is able to provide information, physical and emotional support to not just the woman, but also her partner. She is with you continuously, often joining you at home, helping you know when to go to the hospital based on your preferences and situation, things you've talked about prenatally. And she's there not just for the mother, but also for the partner. She makes sure the partner knows what's normal and what's not, gives the partner breaks to rest or eat. She focuses on the comfort and experiences of both people so that they can relax and enjoy the birth experience in an informed, supported way. Now, good doulas are also non-biased and non-judgmental. They acknowledge that every birthing couple knows what is right for them. She facilitates these wishes, and she acts as a part of the birth team, but she's beholden only to the birth family. Unlike, the hospital where they are employees of the hospital, this doula is here just for the mother and her partner. She's going to enhance your experience with some hands-on support, encouragement. She can help fill in informational gaps if the medical staff is out of the room, but she can also help you get the information you need from your medical staff as you make your decisions. It's a common misunderstanding that doulas are there only for unmedicated births or home births. And honestly, about half of my own clients know that they want pain medication in labor. My job as their doula is to be supportive and helpful for all of the steps in the whole birth. There's a large amount of data to support the use of a doula during labor for improved outcomes and mom satisfaction and partner satisfaction. In fact, here's some data. The continuous support of a doula provides these improvements. There's a 39% decrease in the risk of a cesarean birth, a 15% increase in the likelihood of a spontaneous vaginal birth, so that means no forceps or vacuum extractor, those things that can help with a vaginal birth, 10% decrease in the use of any medications for pain relief, shorter labors by, big old 41 minutes on average, 38% decrease in the baby's risk of a low 5-minute APGAR score. So that's, how they assess how the baby is transitioning to life outside the womb. So better numbers there. 31% decrease in the risk of being dissatisfied with the birth experience. And that's really huge. That means that having a doula just enhances your own memories of it, your own views of yourself as you go through it. Now below you can find the link to a more extensive breakdown of this research on the evidence-based birth website, so you can see where I got those numbers. Your doula can also help you make an informed decision about your care provider and your place of birth. So if you're still trying to figure that out, like where do you want to be, who do you want to hire, this is someone who's kind of like a secret shopper of all the birth options in your area because they go to many different hospitals and they work with lots of care providers. So how can you find a doula? First, check out organizations like DONA, which is Doulas of North America, Kappa, Birthing from Within, Alice. There's a lot of different organizations that will have listings of their certified doulas that you can look into. There's also local directories of birth people. Like, I'm in the Chicago area and we've got one here. Websites like doulamatch.net where you can look up doulas in your area and see if they're available to you. You can ask your provider, your doctor, your midwife for recommendations. They've seen a lot of doulas. They're like secret shoppers of doulas. So they can tell you who they've seen that they respect, that they know is not going to have some of that bias or judgment or being obtrusive, but someone who knows how to work with the team and support the parents. There's also, look into Facebook groups of new parents in your area. Find out what doulas those people have loved and recommend to you. So finding a doula in some way, here in Chicago area, we also have Chicago volunteer doulas. Sometimes there are community-based doulas that are available for low-income women. Sometimes you can find doulas that are new and just trying to get some of their certifying births, and they'll work for a very reduced fee. There will be options for you to find someone, even if money is a struggle for you or something that you have to be tight with right now. The fourth thing that you can do to be proactive to get ready for this baby's birth is to check your us versus them assumptions. What do I mean? Now, I know in the last video we talked a lot about this, and I'm going to re-emphasize it here in this list of proactive steps. You need to be self-aware of your feelings and assumptions as they relate to your care provider, your place of birth, and the ways birth can go. Within these feelings and assumptions, do you detect any sort of dissonance that you have? What do you picture when you think about getting to the hospital or other place of birth? Do you believe your provider has your best interest in mind? Or are you kind of gearing yourself up for a battle? Do you have a sense that you can meet each decision and unexpected event with some presence and some openness? Get an overall understanding of not just the biological process of birth, but also the ways medical intervention might serve you. You can be savvy about this, and you can realize that there's so many ways that you can be supported in your birth, and you can be savvy without being obsessed about it. The fifth proactive step is just learn how to cope. This is something you can do every single day between now and the day you give birth to your baby. No matter how birth goes down, whether it's a 3-day induction, maybe a scheduled cesarean birth, maybe the baby's born in the car, or it's a quick 12-hour labor, there's going to be discomfort, there's going to be pain. Luckily, there are mental and physical tools that you can learn and you can hone now to be ready. And coping does seem to fall into these two categories. Coping does fall into these two categories. Looking at what's inside of me that I can draw on and what's around me that I can draw on. Look at the first one, what's inside of me. Good coping keeps you focused on the present moment, very present, contraction to contraction, breath to breath. And this is a skill you can learn through meditation or mindfulness practices or even physical exercise. Most mindfulness that keeps you calm and present in labor involves your breath and your movement. Many people who have some sort of meditation practice might be able to call on that during labor, but most people do not practice their focus skills in the face of real discomfort. To teach your brain how to handle discomfort in labor, you have to practice and practice and practice with discomfort now. So let me be clear. You can't just read about it. You can't intellectualize it. You have to get it into your body. And you get confidence through experiencing how different techniques work for you. Practice the ergonomics of positions and comforting touch with your partner or any birth companions that are going to be with you. Learn what kinds of breath help change the state of your own body. And the more you practice these things, the more you can like fine tune what works for you. The faster your body responds. Every time you start the technique, your body just locks in because it's something that you've learned over time, and your body responds to quicker and quicker. It becomes a trained response. So then looking at what's outside of you, what's around you, there is your birth supporters, hands and touch. There are actual physical massage and pressure techniques that they can use to help reduce the discomfort of contraction pain and lower the stress response in your body. Those are learnable ahead of time. Find out if your place of birth has tubs or showers available to help you in labor with the use of water. And there's also a lot of really cool tools and supplies that you can bring with you or, ensure that your hospital has. So below the video, you're going to see a list of all those tools, but we're just going to go through them now. First, a birth ball. This has become a mainstay in the birthing world. So they're also technically called like physio balls, exercise balls, or Swiss balls. We're going to call it a birth ball because that's what they're going to call it in the hospital. Most hospitals have them, but it's a great question to ask during a hospital tour or maybe at a prenatal appointment with your doctor or midwife. I also encourage my clients to just buy one to have at home for early labor anyway. For the low cost, it's a supremely helpful tool for early labor. You can drape yourself over it, you can sit on it, or even lean over it on the bed. It gives the benefit of being able to move your hips without having to fully support your weight. And the nice thing is, even after your baby is born, they're really great for bouncing, crying babies and getting them to sleep. Another tool is the peanut ball, and this is a newer item on the birth scene. It's especially useful if you are planning on pain medication for labor. Placing the peanut ball between your knees while you rest helps to open the brim of your pelvis, and that helps the baby to move down and through the pelvis. In fact, one study showed a drop in the cesarean rate from 21% of women who did not use a peanut ball to 10% of women in the peanut ball group. So yes, it cut the cesarean rate in half. I carry one of these to every birth, so you can ask your doula or you can ask at the hospital if they have one available for you. I also always bring with me hot packs. So much pain relief in labor is through the rear end, through the sacrum. There's counter pressure, squeezes, shower streams, heat. Below you can click through to read the article about exactly why this is, what's happening in the body. The article is called The Sciencey Reason Why Birth is a Pain in the Ass. Some hospitals have disposable heat packs available for you. I also like these reusable heat packs called hot snaps. They're a little hotter, they last longer, and you can take them home and boil them and use them again later. If you want some big guns, you can click over to my Etsy shop. I make heat packs out of flaxseed that can be warmed in the microwave, and they tie on so that supporters can do other things like massage you and squeeze your hips. I also think that a sling or rebozo is helpful. There are a million uses for a long strip of fabric in labor. It's kind of an advanced technique, the graduate level pain coping. It can be used to help relax the rear end, shake in the butt to reposition the baby. It can be wrapped around the belly to help keep the torso tight and nudge a baby onto the cervix. It can be a tool for pulling down during pushing or using a little tug of war to help engage the right muscles with a squat bar. You can use a traditional rebozo or Mexican shawl, but I also prefer a ring sling. The ring sling, which is a baby carrier, I like this because it has rings on one end, so sometimes you can use it different ways, that are just more available to you than a strip of fabric. I also love to bring with me to a birth an eye mask. It's not easy to rest in a hospital. The computer is on, many of the machines have lights that are glaring, and sometimes your staff will need to turn on the overhead lights to do their job. An eye mask can make all the difference if you're trying to sleep during labor. And even when the baby is here, you will likely be trying to rest during the day just as much as at night. So you can help yourself get right to sleep with this super comfy eye mask. I actually have two. I have one for myself and one for my clients. In the same vein, thinking about earplugs, hospitals are noisy places. Staff's occasionally popping by, there's beeping machines, other patients. Earplugs can help you shut it out so you can shut down. Or maybe you want to think about using music. It's sweet preparation task to compile playlists, that you might want to use during labor. I recommend at least 2 playlists with kind of different energies. One list that's the Enya, hippie, airy fairy for the more relaxing times of labor, but also make the Salt and Pepper, Eye of the Tiger, Get Shit Done playlist. So here you can use either a Bluetooth speaker or these earplug or headphones. I like these a lot because they're waterproof and wireless as well. So you can just wear them, and get in the shower, do whatever you need to do. Thinking also about the lighting, many women have an instinctive desire to have the soft, romantic lighting for their births. And this isn't just like a lovely idea or a silly obsession with the experience of labor. Turns out the lighting affects your hormones. In darkness, our bodies create a hormone called melatonin. New research is showing us the relationship between melatonin and oxytocin, that hormone that causes contractions. And by being in darkness, our labors are more effective. Having dappled, flickering light like candles or fire, our modern overthinking brain can't anticipate the pattern of the light, so it relaxes. And our intuitive primal brain takes over. So this is why candles are so relaxing and even romantic. Now, of course, you can't take candles into a hospital where there are oxygen tanks, but you can get a very similar effect with either LED tea lights or a strand of twinkling lights or Christmas lights. So you just plug it in and drape it across like the windowsill or a table. Looking at other senses, the sense of smell is very important for changing your perception of your moment of what's going on. I like to have my clients bring their favorite lotion, their favorite fragrance lotion. So if I'm going to give them a foot massage or something, I'll use that. Or they can pick a few essential oils. We can dab some drops onto a warm towel so that we can either, keep it in the room where she can smell it, or if she gets sick of it, we put it in the laundry. That's a nice thing to bring to help you cope. Also, some basic toiletries. Now, while it seems like this isn't about coping, it really can be a miraculous touch. After being awake for at least one night, brushing your teeth or refreshing your deodorant can make you feel human again. The hard work of labor takes its toll on our bodies, and many women and partners find stamina to keep working after a hygienic reset. And your toothbrush, some toothpaste, mouthwash, deodorant, body wipes or baby wipes, just to refresh your pits, maybe even some dry shampoo. And then I think another thing that can very much help you get through, especially a long labor, is some source of electrolytes. Labor is a physical task. It involves muscles, not just in the uterus, but in your whole body as you work and you walk and you sway and you push. And some say it's even like a marathon. These muscles are going to benefit from electrolytes. My favorite portable source of electrolytes is Nun tablets. It's a little canister that you just take a tablet out, drop it into your water, so it's more portable. You don't have to take a 6-pack of Gatorade in your bag with you when you get to the hospital. And finally, consider purchasing a TENS unit, or even ask your doula if she carries one with her. They aren't commonly found in hospitals. A TENS unit, it stands for transcutaneous electrical nerve stimulation. It sends subtle electrical pulses through your muscles. So this works in labor because it disrupts the flow of pain signal to the brain. Instead of contraction pain, the brain picks up the TENS sensation. And you can control how strong it is with a little remote. Some speculate that it may also work by urging your body to make more endorphins in response to the sensation. And there have been a few studies showing how effective it is in reducing perceived pain and improving a woman's experience and sense of control over her labor. They're also great for aching muscles, not just for labor. I take mine out of my birth bag for my own use all of the time. So there's a link in that handout for the one I use specifically. They're not too expensive, and they're definitely reusable and lovely to have. So those are the nice tools you can get or look for or ask around about. And the next thing you can do, the next proactive step you can take, is to tap into your inner parent self now. One way to choose to tap into this inner self is to find an inner confidence in your ability to navigate the unknown. So birth, like parenthood, is about improvisation and rolling with the unexpected. And you can absolutely practice that now. You can start a new practice that cultivates your inner quiet wisdom and exploration, where you're being introspective and you're trying to make decisions in a new situation. Things like a new art hobby or a new exercise or movement practice. You can start a garden. Just anything to make you uncomfortable, anything that's going to help you become a beginner. Do something that's outside of your view of yourself, something that's even the opposite of who you think you are. This open exploration of new rooms in your personality will show you even more what you're capable of and give you some of that confidence you need to get into birth, to get into parenting, and to start to learn who you are in this new role. And finally, one of the biggest steps you can take, the biggest things you can hold on to get ready for birth is maintaining your joy. It's easy to get bogged down in worry and planning and fear when preparing for birth. Now, some of each of those is healthy, right? Well-placed worry can spur you into action. Some planning means that you can relax more on the day because you have arranged the parts you have some control over. And some fear is normal because birth is a big deal. A baby is being born and your body's going through a huge transition. Through all of it, you can cope and thrive with a return to the joy of becoming a parent. And maybe this is an easy task for you as you're so excited about entering this new part of your life. So you are, bubbling over with anticipation and willing to do anything to get your baby in your arms. Or perhaps this is a harder transition for you. Some expectant parents are surprised to find themselves grieving for their former lives and selves, or vexed with concern about how much their lives are changing. And this too is normal. That's what makes it a rite of passage, that there's some turmoil going on, a change in your self-perception and in yourself. Now, to be clear, maintaining joy doesn't mean like sticking your head in the sand while chanting loudly, everything will be great. No, really a mindset of being present even to the hard parts and through the hard parts, bringing your absolute best self to whatever comes your way. And I think there's 2 tricks to give you perspective during this life transition. It's going to free you up to hold on to some of that joy. So first, acknowledge fully what parts of yourself and your life will go away once you become a parent. Like, face head on the inevitable losses, the loss of freedom, sleep, control over your body, ability to fully commit to work or hobbies, changes in your relationships, financial shifts. It is healthy to mourn and say goodbye to those parts of your life. If they're changing for a long time or just a short time, write them down. Talk about them with your partner and your other people that you trust. The second trick, I think, is to fantasize about the good parts of the future. Begin to picture what parts of parenting that you think you're going to be good at. Who will you be as a mother or father? Will you be organized? Will you be adventurous? What values will you pass on to your children? Now, you don't have to parent like your own parents or your friends. You will bring your unique gifts and personality to this endeavor. And you don't have to be perfect or have all of your psychological baggage sorted out before the baby arrives. Also, thinking about how will you still be yourself and a parent? Like, what 1 or 2 parts of yourself are you motivated to keep alive through this major life transition? Perhaps you want to ensure that you have a weekly date night with your partner so you can keep your relationship healthy. Maybe you are hoping to get back to fitness after a few months, even if it's just a couple days a week. Make a choice every day to focus on the joy of this life change. Embrace hardship as an opportunity for growth. Embrace pain as a director towards comfort. Embrace struggle as a sharpener of all your edges. And even in labor, keeping in mind that this is the birth of my baby and the birth of us as parents, or reminding yourself, I'm going to meet my baby soon. And you can solidify this by bringing in a physical reminder, like a baby onesie or an ultrasound picture, or maybe a hat your grandmother knit, anything like that. It becomes a focal point through all of labor, remembering the why behind what you're working towards. So keeping that long game in mind, maintaining perspective and choosing joy, you literally change your body and brain chemistry with this sort of positive thinking. So let's go right through the list one more time. This is the solid list of what you need to do to get ready for birth for real. Carefully choose your care provider. Tour your place of birth and get comfortable there. Get a doula. Check your us versus them assumptions. Learn how to cope. Tap into your inner parenting self now. And finally, maintain your joy. My hope is that just this video series alone is going to help you get ready for birth in a more realistic, more holistic way. I think of it like a wind-up car that I pull back and I direct it where it should go and I release it. So go forth, take these tools, take these ideas, take your whole heart and your whole self into your birth. As always, leave any comments or questions below. Share it with people you think could use this free course to help them prepare for the great, fantastic birth adventure. Thank you for coming along with me.